Interesting. And what is the status of Ibogaine in Canada? Is it legal? Is it sold in stores?
It's not classified at all, really. So in the United States, like I said, it's a Schedule 1 substance, which means that it has no medicinal value at all. In lots of the other places in the world that I described where they're doing treatments, it's not classified. So there's no kind of, right now in Canada, there are, like I said, there's some treatment centers on the West Coast, but because of the advocacy work that some people are doing in the United States, people are hearing about it, but there's not a lot of public awareness about what Ibogaine is or what it can do. And so I think that there's a lot that can still happen with Ibogaine, but partly as a result of the fact that there's no regulation at all, there's risks that come up because you can order it on the internet. You can order like raw Iboga product in bulk on the internet and do your own extraction, have your own experience, just like you can order, lots of naturally occurring entheogens on the internet. But there are risks involved in doing Ibogaine treatments. So I think having a center with people that have some sort of background and experience themselves in order to help process the experience is really important. And there just aren't people in Canada that have that kind of experience yet, or at least there's not very many. So hopefully part of what I'll be able to do in Mexico is get some of that experience and bring some of that back.
Can you tell us a bit about the clinic that you're going to?
Yeah, it's in Tijuana, which is right south of the border. So it services a lot of, my sense is that it services a lot of clients from California and other parts of the States where people come because it's illegal in the States, right? So, it's a detox center, and I know that this particular clinic started with treatments that were happening in Mexico City, just sort of underground. Somebody discovered what Ibogaine does and started using it, and then they found that in order to help people better, they needed to move to Tijuana rather than Mexico City so it was more accessible. And so from there it's developed, and I know that the people that I'm going to go work with that own it now have done a lot of work to bring in medical equipment and also to bring in a focus on brain nutrition, which is a really important part of any dealing with any mental health or addiction processes, to be really conscious of the fact that in order to facilitate that new growth of regenerating all those neurons in your brain, you need to have like the vitamin C and the B complex vitamins and a lot of those things in order to keep that strong and to rebuild that. So there's still like a momentum of developing the treatment, and that's what's happening right now with that clinic.
Well, it's a good lead into my next question, is what do you see for the future of Ibogaine in Canada, in North America, or even the world?
Well, I know that there's another clinic in Mexico, not the one that I'm going to go to, but I know that I'm not sure who else is involved with it, but there's somebody that I've been in touch with there they're organizing an international Ibogaine foundation or federation, and so I think part of their process is standardizing a treatment procedure, and I think that's really effective, is for there to be conventions of treatment providers to share information about what they're learning, because right now there's some different strategies and different things that people are learning in different parts of the world. So there needs to be a lot of information sharing, because I think that there needs to be like a respect for what the traditional cultures in Gabon have learned about Ibogaine for a long time. But when you're in a treatment center context, there's a really particular focus about what you're doing. So there's a lot of information that people are just gathering about how to do that particular process. So there needs to be a lot of sharing and integrating that kind of experience. And then I think it's important to make it as available as it can be and reduce the risks as much as possible, and to make sure that when people are, I know that there's people that are doing treatments in different parts of the world sort of out of their homes and underground in the United States even, and things like that. And I think that that's amazing that they're making it available, but there needs to be more risk reduction involved. So I think that the establishment of centers sort of meets the demand in a better way than needing the demand to be met by an underground treatment. So I think that it's important to realize that those things and those underground practices are sort of a symptom of the fact that there's a massive demand for that kind of treatment. And so I think it's important to like establish something that the mainstream world can be aware of and see and appreciate.
Certainly. And the challenge of, in the U.S., it being a prohibited drug also makes it, I guess, impossible to do any sort of above-ground sort of clinical trials with it. So.
Yeah, there's lots of barriers to making Ibogaine available in the United States and in other parts of the world. Like, for one, it's a natural substance, so pharmaceutical companies don't really like to touch those. Another one is that it's not a maintenance drug like a methadone treatment, so you take it once, twice, 3 times, and you can be, if you haven't been sucked back into this vacuum repeatedly and you are moving forwards, like that's going to treat your habit or your addiction or whatever your intention was. So there isn't as much money to be made on it in that way. Another thing is that the FDA in the United States and other regulatory agencies around the world like medications that work on one receptor site in the brain, while Ibogaine obviously works on many, and we don't know everything that it's doing, but it's doing all kinds of different stuff at the same time. They don't really like that. They like a direct cause and effect relationship between a medicine and a patient. So yeah, there's other barriers like the supply of natural Ibogaine and things like that. So and one of the major barriers is that Ibogaine is classified as a hallucinogen in the United States, and it does produce a waking dream state or a visionary state, and there's a massive misunderstanding of that in our culture, and there's a prejudice against those kind of experiences and what they're able to produce, which is kind of a Puritan value, but it still exists in our culture.
Certainly.
So tons of barriers, but it's also
moving
forward.
Someone wanted to learn more about Ibogaine, where could they go?
Well, you'll be able to check out, I'm going to do a video blog while I'm away, so that's going to be pretty much, that's going to be my firsthand experience of the treatment center in Mexico and any other work that I'm able to do. And you can check that out at www.ibogavisions.com. That's up right now. There's not any video on it, but you can subscribe to the email list for when there is. And I would say one of the best places is check out YouTube, because there's lots of videos. There's you can get a bunch of cool documentaries if you want to see anything about Iboga and the traditional culture. One really cool one that I just found was by a journalist, Bruce Perry, who goes and does a ceremony with the Babongo people. So that's a really interesting look into where exactly Ibogaine comes from. And yeah, there's Ibogaine Rites of Passage, a documentary. So lots of visual stuff. I think it's important to get a visual with Ibogaine because it's a huge component of the experience itself. So, but and just a Google search, there's Wikipedia and everything like that. So the information's out there. It's, like all information that's out there, you can Google it and you'll find a lot.
Excellent. Yeah. Excellent. Well, thank you very much for sharing with us. On behalf of Canadian Students for Sensible Drug Policy and our supporters, we wish you the best of luck in your journeys, in your travels, and we're very excited for you to come back so we could sit down and sort of learn what you have learned. So yeah,
we'll debrief.
Definitely. Yeah. Thanks, John.
Cool. Thanks, Caleb.